Hi, good afternoon. Dr. Carlos Bautista here. I've been having requests from you guys to talk and to explain briefly about pancreatic cancer. Pancreatic cancer, it's unfortunately one of the most lethal type of cancers. The pancreas is an organ, as you know, that it's in the middle of our abdomen actually, and behind the stomach, and it's in charge of producing insulin, as you know, and also is in charge of producing certain enzymes that will go and help us with digestion. Cancers, the majority of the cancers in the pancreas are called adenocarcinomas, which means that they originate from a gland, and that's the adeno part of it. It's a very serious type of cancer. It grows rapidly. Okay, usually it spreads to the liver, unfortunately, quickly. Obviously, like with all cancers, the possibilities of a cure are higher when it's discovered in an early stage, meaning that it's only confined to the pancreas, to the organ. When it goes to other organ like the liver, that's where it usually spreads, and these spreadings are called metastases. Unfortunately, the situation is more difficult. Chemotherapies, unfortunately, don't work that well for this type of cancer. Conventionally speaking, there's medications. There's been some research protocols that have been done, and without that much change from what is being already tried. What we do here, we have a better response rate than in conventional therapy. What we do mostly are immunotherapies. Sometimes we even use some new generation medication immunotherapy in combination with the alternative therapies that we already have in place for this type of cancer. I'm talking about whole body hyperthermia, where we raise body temperature to destroy cancer cells; local hyperthermia, where we increase intratumoral temperature to around 100 and 106; DPT with B17, where we deliver this medication directly to the cancer; immunotherapies, where also it's important that we increase specifically immune stimulation for the immune system to detect and fight cancer. Obviously, each case is different, and there's some patients or some people that have asked me to tell that what we do, but it's different for each case. So if you would like to know what we can do for pancreatic cancer, just give us a call. You can go to our website, which is immunitytherapycenter.com, and we'll talk with you about specifically your situation. For example, pancreatic cancer can trigger severe pain. That's because the pancreas sits in front of the celiac trunk, which is a nerve complex that when depending where the tumor is growing, it can make compression on that nerve, and that will be triggering severe pain that will irradiate to the lower back and the abdomen areas. For that, sometimes you need to consult a pain management doctor, but definitely the best pain control will be to be able to reduce the tumor, so the pressure in that nerves decreases and the pain subsides. So Usually there's different options from medications. There's some blockages sometimes that we can do here when something like that is happening and the pain is uncontrollable. But usually the best pain management that we have is that we are effective treating this type of cancers. Digestively, also you can have a lot of situations, a lot of problems, bloating, and problems digesting food, pain when having something to eat. So definitely all of those symptoms, depending on the origin, you need to discuss with your doctor. But using, for example, some infrared heat on the abdomen, and using there's a therapy that we use here that is called RIFE. Using bioresonance treatment for the symptom could be also very beneficial. Well, I'm sure there's going to be questions, so please just leave it on comments, and I will address them individually. And if you want us to analyze your case, just give us a call. All right, so thanks a lot, and I will see you next week. I will start producing some small short videos to talk about different symptoms in cancer, about what you can do, and so on. Okay, so again, I will ask you to please leave on comments any questions or concerns that you have, and we will answer as soon as we can, or in the video that we're gonna talk about in the week. All right, thanks a lot, and I'll see you next week. Thank you.